And April is Autism Awareness Month. It's a time to raise awareness of autism spectrum disorder, which impacts so many people and families. And this afternoon, we have Dr. Sharnita Harris, the Clinical Director of Psychology for Nationwide Children's Hospital Toledo, with us here this afternoon. Thanks for being here.
It's great to be here.
So what is autism spectrum disorder and how common is it among children?
Yes, autism spectrum disorder is a neurodevelopmental disability that is characterized by differences in social communications and the presence of restricted and repetitive patterns of behavior that may interfere with activities of daily living. The Center for Disease Control has 1 in 36 children diagnosed with autism spectrum disorder, with prevalence higher in males than females.
Okay, interesting. And at what age are children typically diagnosed, and does it vary by age or state of development?
Absolutely, that's a great question. So with autism, just like with any other thing, it can vary greatly depending on the child. But on average, between 12 and 18 months, parents may notice behaviors that may raise concerns for possible autism spectrum disorder. But then there's other children who those concerns might not become more apparent until they're a little bit older, once social demands start to increase. It really is unique to each individual child.
And you mentioned something before. Sometimes it's harder to diagnose it in girls than it is boys, or was it the other way around?
No, I was saying that boys have a higher prevalence rate of being diagnosed with autism spectrum disorder.
Okay, got it. So how is it diagnosed then? Are there certain tests or things that help diagnose it?
Absolutely. So we use a comprehensive evaluation process where we're interviewing a family to hear about the things that they're noticing at home. We do standardized rating forms for the parent and teacher so we can get information across the environment. We're also looking at their language level, their cognitive and developmental skills, just to get a better idea, and then using all of that data information to put a comprehensive report together for a family with recommendations and our impressions.
How important is early diagnosis for families?
Early diagnosis is really important because children are able to get connected to the services and supports that may be needed to help improve social communication or to help reduce restricted and repetitive or self-injurious behaviors, again, that's interfering with their activities of daily living. So that early intervention is really key to get that diagnosis as early as possible.
And once that diagnosis comes, what does treatment or therapy look like for these children and families?
Absolutely. There's a lot of variability in what the services and treatment could look like. What we generally want to focus on and make sure these services are evidence-based, that there are supports to say that they work. Things that we think about are behavior therapies that focus on skill development. We think about speech therapy, occupational therapy, feeding therapy if there are any feeding concerns, social skill development groups, as well as just working really closely with your diagnosing provider to think about what areas does this child need and how to help maximize those areas that may need more improvements.
And for parents or families watching at home, if they think their child might have autism, what should they do?
Absolutely. If you have concerns that your child might have autism, bring those concerns up to your child's primary care provider. I really caution parents to avoid a wait-and-see approach because we know that earlier intervention leads to better outcomes. So if there's a question, raise it to your child's pediatrician and they can help you start the process of seeking an evaluation.
So the earlier the better, get connected, and you mentioned some all-encompassing sort of therapy options, so that's really good to know.
Yes, absolutely.
Thank you so much for being with us here.
It was my pleasure.
Very helpful information. Thank you so much.